Then let's start the lecture first. Uh, Today's topic is uh, called adrenergic agonists, and adrenergic agonists are the most clinically useful drugs, and they are divided to direct and indirect acting. Direct acting adrenergic drugs activate the adrenergic receptors. Indirect acting drugs will not activate the receptor itself themselves, but that they will uh, or increase the release of the epinephrine, that is adrenaline, or norepinephrine, that is noradrenaline, from the synaptic cleft. And uh, according to these, the adrenergic receptors are divided into several classes. That includes the direct acting agents and indirect acting agents. And some of them also have a mixed direct and indirect acting action. But the most of the adrenergic drugs that are called sympathomimetics are direct acting drugs, and the the prototype is the epinephrine and norepinephrine, because norepinephrine is released in the synaptic cleft and epinephrine is re released by the adrenal medulla. So the trade name of the epinephrine is adrenaline, that is commonly used in Russia. And other adrenergic agents, sympathomimetics include isoproterenol. Isoproterenol is the beta selective. Then phenylephrine is the alpha selective. And also dobutamine is a beta also. Clonidine is central alpha. Dopamine is non-selective. And then albuterol. And so sorry we started without you. So next time don't be late. Uh, albuterol and terbutaline are selective beta uh, and used for treating asthma. So that's why their trade names have vent. Or vent means for ventilation of the lungs, or pro air, that allows air to come to the lungs. So and phenaldopam is actually uh, used against the is useful as or antihyper antihypertensive drug. So formoterol is also used for the asthma, but is long acting. So these are direct acting drugs. Indirect acting include amphetamine. Amphetamine and cocaine are not the drugs, and the the use of this drug is prohibited in Russian Federation. However, in some countries, like in some European countries, these drugs are used and have some clinical application. Like amphetamine is used to treat hyperactivity syndrome in children, and cocaine is used as a local anesthetics in some ophthalmologic operations in surgery. And then also indirect acting drugs that have some direct acting or mixed action drugs are ephedrine and pseudoephedrine. Pseudoephedrine is the derivative of the ephedrine. Ephedrine and ephedrine is obtained from the plants, from the ephedra, and pseudoephedrine is a chemical modification of the ephedrine. So this is a classification of the drugs, and there are two systems that activate the adrenergic receptor in the body. The first is the sympathetic nervous system. They actually both are sympathetic, but it will be different. So the postganglionic sympathetic neurons release norepinephrine, and they activate adrenergic receptors in effector organs, usually muscles. And also the adrenal medulla releases the epinephrine into the blood, and then epinephrine will travel with the blood to the different organs, and that will also activate the adrenergic receptors. There is no neuron here, but nicotinic, the adrenal medulla can be compared to the neuron, like it's large neuron that releases the epinephrine into the blood. So the norepinephrine is synthesized in the nerve ending from the tyrosine. So the first step is the hydroxylation of tyrosine with the product deoxyphenylalanine, or dopa, and dopa is the predecessor of the dopamine. Dopamine is captured by the vesicles, and in the vesicles converted to norepinephrine, and some drugs are inhibit the transport in the vesicle, and then that reduces the release of the norepinephrine, and reserpine is acting like indirect blocking, but we will discuss reserpine next week. So then the norepinephrine is released after the entrance of the calcium, into the cell. So this is called exocytosis, and this step is blocked by the guanidine. That is another non-direct blocker, but we will also discuss this next week. So then the norepinephrine is binded to the postsynaptic or presynaptic receptor. A presynaptic receptor usually inhibits the release, and presynaptic receptor is usually inhibits the release, and postsynaptic is usually results in some response. Can be contraction or activation, release of the uh, saliva, or any contraction of the muscle. And then the norepinephrine is uh, destroyed by catechol or methyltransferase or COMT, and then uh, so the some of the norepinephrine can be retaken retaken by the neuron, and this process is inhibited by cocaine and imipramine. Those two are selective norepinephrine reuptake inhibitors. So imipramine is actually an antidepressant, and we will discuss it next after the test. So the next, I think somewhere in December. So this is the synthesis, storage, release, binding to receptors, and removal of the norepinephrine. So the captured norepinephrine is used, is fed to the vesicles again, and then can be released again. So there are several types of the receptors. The adrenergic receptors are divided to alpha and beta. So these are two main families of the receptors, and the division is done according to the responses to the epinephrine, norepinephrine, and isoproterenol. So the alpha receptors are have a low affinity to the isoproterenol. That is why isoproterenol is called a beta agonist. So because beta receptors have high affinity. So the epinephrine is the best agonist for the alpha receptors. Norepinephrine is approximately the same but a little bit less, and isoproterenol is much less for the alpha receptor. And for the beta receptor it is a little bit different. Isoproterenol goes to the first place, then epinephrine and norepinephrine. So this is, but in these are these are approximately the same affinity. So the alpha receptors have second messengers, uh, the activation uh, activates the G protein, and then uh, this G protein can activate secondary messages like uh, phospholipase A2 and uh, deacylglycerol and inositol 3-phosphate. So these are second messages, and inositol 3-phosphate initiates the release of the calcium from the endoplasmatic reticulum, and deacylglycerol uh, can activate the proteins in the cell. So this is alpha 1 receptor action, and alpha 2 receptors usually decreases production of the cyclic AMP, that is cyclic adenosine monophosphate, leading to the inhibition of the further release of norepinephrine from the neuron, because cyclic AMP uh, uh, usually stimulates the process. So decrease in the CMP will decrease the release of the norepinephrine. So this is a negative feedback. So when, for example, when students study and they don't like something during the study, they give a negative feedback. This is the same as the feedback you give, so that decreases the release of the norepinephrine. So there are differences in the chemical structure of the epinephrine or epinephrine, and all the most of the drugs in this group are derivatives of the uh, cathechol. So cathechol is the aromatic ring with two hydroxy groups, and the rest is actually amine with a nitrogen and hydroxyethyl group. So norepinephrine is actually uh, 3,3,4 dehydroxy uh, benzohydroxyethyl amine. So this is chemical formula and chemical name of the norepinephrine. So epinephrine is different because has additional methyl group with the M at the nitrogen, and isoproterenol is called isoproterenol because it has iso isopropylic group. So but the rest of the molecule is the same. So, and with the increase of the group uh, on the amine nitrogen, the affinity for the beta receptors increases as well, because norepinephrine has less affinity for beta receptors. Epinephrine has larger, and isoproterenol is have much larger affinity but is not acting on alpha anymore. So this increases the affinity for beta and decreases affinity for alpha. Besides these two, ephedrine is a non-direct acting. The difference is does not have the hydroxy groups in the aromatic ring. Then additionally have a methyl or in the second in the alpha carbon, and dopamine is also have almost the same structure, but there is no hydroxy group in the beta position. So beta carbon is without hydroxy group. So this is the chemistry of the adrenomimetics, and the beta adrenomimetics. So the indirect acting adrenomimetics will, or sympathomimetics will act on the release of the epinephrine. They will activate the release, and some of them can have direct action. Direct action is the most common, and there are some that have this both the indirect and direct action. So the epinephrine, norepinephrine, and isoproterenol act differently on the pulse rate, blood pressure, and peripheral resistance. So epinephrine will increase the heart rate or pulse rate, and also the force of the cardiac contraction, and that will lead in increase of the systolic pressure and decrease in the diastolic pressure. And then it will also decrease the resistance of the vessels because diastolic is decreased. And epinephrine is can be injected intramuscularly, intravenously, and subcutaneously. The metabolites are appearing in the urine, and central penetration is bad. Can be used as an aerosol, but is rarely used as aerosol. Usually used intravenously or intramuscularly. The norepinephrine leads to the reflex bradycardia because the activation of the alpha receptors in the vessels, because it has a high affinity for the alpha receptors. And this high affinity will increase both the systolic and diastolic blood pressure, and will tremendously increase the peripheral resistance. And isoproterenol is purely beta agonist and will increase the heart rate and then increase the blood pressure, and while decrease the diastolic because of the acting on the beta 2 receptors of the smooth muscles, and also will decrease the peripheral resistance because of the beta 2 receptors activation in the smooth muscles that decrease the pressure. Alpha receptors increase the pressure, beta decrease the pressure. So the isoproterenol is will decrease the tone of the smooth muscles and dilate the bronchiole, then will dilate the vessels, and these are beta 2 and beta 1 is in the heart. Beta 1 receptors are in the heart, so isoproterenol will increase the heart rate and blood flow. So blood flow is dopamine, so from the kidney. The decrease in the beta, the decrease in the turn of the bronchiole or bronchodilation is used with the treatment of asthma. So, and the bronchodilation time onset is important. So that is why epinephrine is used when the rapid onset is required, uh, usually by the emergency, and then terbutaline and albuterol are used for also as an inhalation, and they have several hours of duration of action, and formoterol and salmeterol have a longer duration of action and use also by inhalation, but are long sorry are long acting drugs. The adverse effects of the sympathomimetics include arrhythmias because of the tachyarrhythmias, because of the increase of the heart rate, headache, hyperactivity, and insomnia are connected central nervous system adverse effects, and nausea is the GI, is the inhibition because of the inhibition of the parasympathetic nervous system, and tremors are because of the also nervous adverse central nervous system adverse effect. Then the uh, indirect acting sympathomimetics uh, inhibit reuptake or increase the release of the epinephrine or norepinephrine, and they also increase the production of the norepinephrine, and this includes amphetamine that stimulates the central nervous system uh, and is used by the drug abusers, and it also increases the blood pressure by acting on alpha 1 receptors and stimulates the heart by acting on beta receptors. Uh, is mostly These symptoms are mostly because of the release of the dopamine and norepinephrine, uh, but we will discuss them later in December. Tyramine is uh, synthesized in the body and important because of the fermented foods such as fermented cheese and Chianti wine. So if you visited some Toscana province in France, they produce a Chianti wine that has much tarragon in it. So normally the tarragon is oxidized by monoamino oxidase in the GI, but some patients can take the inhibitors of the monoamino oxidase that are actually antidepressant drugs, and that will lead to the vasopressor effect. Uh, the tyramine enters the nerve terminal and displaces the norepinephrine, and then it can be released and act on the adrenal receptors. So that is why uh, some patients, for some patients, the tyramine is, the cheese and wine is contraindicated, and cocaine has a local anesthetic effect because of the blocking sodium chloride channels, uh, and these channels are required for uptake of the norepinephrine to the synaptic cleft. Synaptic, yes, from the synaptic cleft, and that results in increase of the sympathetic action, and increases the action of epinephrine and norepinephrine. So that leads to the increase in the effect of the epinephrine and norepinephrine in patients that abuse cocaine. So cocaine is actually a recreational drug. Uh, it can also increase the blood pressure and also acts on beta receptors. We will discuss the cocaine in detail when we study central nervous system drugs. And then the ephedrine is the mixed action, have both direct and indirect action. Uh, it increases the release of the norepinephrine and stimulates the alpha and beta receptors itself. Sorry. Um, okay. And these drugs have a long epinephrine and not pseudoephedrine. Ephedrine and pseudoephedrine have long duration of action. They absorb orally, unlike the epinephrine, and they increase the blood pressure and stimulate the heart rate, increase the heart rate, and then also produce bronchodilation. Uh, Ephedrine stimulates central nervous system and increases the alertness, decreases fatigue, and prevents sleep. So can be used as a central nervous system stimulant, and it also improves the performance of the in sports. So the can be used as a doping. Uh, However, ephedrine is not used clinically today more because of this side effects. However, pseudoephedrine is still can be used for treating the runny nose. Like I have now a running nose, so I can use pseudoephedrine to treat with the nasal drops. So nasal congestion can be treated with the pseudoephedrine, uh, And also pseudoephedrine can be used to produce the methamphetamine because of the common chemical structure. So that is why the pseudoephedrine is has limited controls, has a control and some restrictions. So it's not the over-the-counter drug because it can be used to produce the legal drug. So unfortunately I couldn't buy the pseudoephedrine because of that, and to put some drops to my nose. That is why uh, so I see that the connection was lost, so unfortunately most of you could not see this, so you have to look to download it uh, later, uh, because uh, I will publish this so you can download later and see the lecture. So thank you for your attention, and see you next week.